Scanning the room.
Hello, my name is Sarah New and I am a nursing student in the Dakota Nursing Program, and today I'm going to be demonstrating how to insert a peripheral IV catheter, as well as how to prime your tubing, how to initiate IV therapy, and how to discontinue all of that after converting to a saline lock. So just going to show the camera that this is just my patient's orders and nothing is right on it. Okay, so I've just received orders for my patient Shirley Coast to receive an IV catheter and IV replacement fluids. So the first thing you want to do is go to the med room, wash my hands. I'm in the med room. I'm going to get all my supplies, and I know that there is a need for this procedure because she has been vomiting for 2 days and she is dehydrated, so that's good. The doctor has ordered 0.9% normal saline to be infused at 150 mils per hour. So I'm going to go ahead and get my normal saline, just make sure that the package hasn't been opened. It is not discolored, there's nothing floating in it, it is not expired. Give it a gentle squeeze and it's not leaking. So I've got that good to go. That's my first med check. I would go ahead and obtain the rest of my supplies, making sure that all the packaging is not expired, not opened, and we can go ahead and go to the patient's room now. So I would knock and introduce myself to the patient, verify the patient with a name and date of birth, explain to Ms. Shirley that her doctor has ordered her to receive an IV catheter, answer any questions she might have about that, and just explain that it's just going to help replace fluids lost while she was sick and it's going to just help her feel better. Okay. So Shirley, like I just said, we're going to be placing the catheter in your arm. Have you ever had one of those before? You have? Okay, so you kind of know there's just like a little straw that stays in your veins so we can have access to give you medications if we need to do that quickly, and fluids. Okay, so first things first, I'm doing my second med check so I can see that it's the same. Now it's time to prime my tubing. And I would place this chuck pad underneath the patient's arm, just get all of my supplies in order so that it's within reach. Okay. Got my IV tubing ready. I'm gonna go ahead and open the packaging. It has not been opened yet. And just make sure the color is good, there's nothing floating, everything looks good, it's not leaking. And one final med check, it is normal 0.9% normal saline, and I know that's going to be infused at 150 mils per hour. I would put my patient's label on there that reflecting all that information I just said. So this is good to go. I'm going to don my gloves. I made sure to wash my hands when I entered the patient's room. We're going to go ahead and put on gloves because we need to maintain aseptic technique while handling this. Okay, go ahead and get your IV tubing. We're using a pump, so this one has a cassette on it. And first things first, you want to make sure your cassette is closed. Okay. And just straightening out on my line. They're not being a knot. Okay, so that's good to go. This is closed. I can go ahead and spike the bag now. Okay, so I'm just going to pull that straight up. Okay, so that's in. At that point, you can go ahead and hang it. All right, so you want to go ahead and just take your cassette. You're going to go upside down, fill up Minnesota, and then you would go ahead and open it. Yeah, sometimes Okay, so yeah, you want to make sure that's halfway full, and sometimes you got to give it a little bit of a squeeze to get it going. And it's going. Just make sure all the air comes out. Sometimes you got to give that a little flick. Okay. Looks good to me. And just put the cap back on. All right, so now your primary tubing is good to go. I'm gonna go ahead and load the cassette. And I would set my flow rate at 150. These things are, okay, so that's in. Okay, this is good. I'm gonna just kind of set this within reach. Just so it's handy. You wanna make sure that tip isn't touching anything. Okay, so now I'm gonna go ahead and go to the patient's bedside and get my secondary tubing, all right, extension tubing. So you want to just prep this by pulling down a little bit, getting that air bubble out. Okay, so that's good. I'm going to go ahead and put the lid back on. Okay. All right, so this one we're just going to go ahead and attach. And remove the cap without touching the tip. And this we're just going to set aside because I'm going to be placing this back in to the packaging. And just straighten out. Give it a good flush, making sure all the air is out. And this tip is still aseptic because it hasn't touched anything. Just going to set this right here where I need it. Okay. So now it's time to go ahead and select a vein. I am going to change my gloves. In between that, I'm going to wash my hands. So first things first, you want to get your IV start kit. Just get all your supplies ready. And I'll make sure and label this tubing before I leave. All right, so we're going to place this catheter or tourniquet under the patient's arm. And we want to find a vein, so we're just going to tie it for a minute. All right, so you want to go ahead and find one as distally as possible. It needs to be palpable with your hands. You need to be able to see it. And when it's palpable, you need to make sure it's bouncy, so it's not too hard. So I think we're going to go with this site on the interior forearm, and I think that's good to go. So go ahead and undo your tourniquet, get your ChloraPrep. Oh, it's right here in front of me. Okay, so get your ChloraPrep. Squeeze. You're going to start in the center. You want to clean for 15 to 30 seconds. And for video purposes, that was 30 seconds. You're going to allow it to dry. Place your catheter back. Okay, so now I'm going to go ahead and stick the vein. All right, so you want to make sure it's bevel up. Okay, you're going to anchor your vein just distal to the site. You're going to go straight in at a little angle, and then you pierce the vein. So as soon as you see a flashback, you're going to drop your angle, advance just 2 millimeters more, and then at that time you want to pull your needle back as you're advancing the catheter. So it's here. You're going to lock your safety, release your tourniquet, all the while stabling that hub. Throw your needle and your sharps, and attach your saline. I would go ahead and flush just a little bit more, just asking the patient if that hurts, if they're feeling any pain. So basically I'm just confirming patency. So that's good. All right, so now you need to go ahead and secure the catheter. Can be a little tricky. So for this, we're going to go this way first. I like to go underneath it. All right, then you want to do an occlusive dressing just to create that extra barrier so that no microbes get in there, and you want to make sure it only goes on the colored part of the catheter so that we can access the hub. Okay, and at that point, I would label the name of the person starting it, me, and the date and time. Okay, so this is good to go. I'm going to go ahead and add my fluids, just again making sure that this stays aseptic. All right, we are on my patient's left, so we want to kind of turn their arm towards where the IV is going to be coming from. So you would secure that to the patient's arm, like so, and turn on your flow rate at 150 mils per hour. Just make sure that's secure. Okay, so that's good to go. Yeah, at that time, just go ahead and clean up your mess, doff your gloves. You want to document in the patient's record the length, the type, and the gauge of needle used, the site picked, the number of attempts, and the fluids, the flow rate, and the person who initiated the fluids. So, okay, so it's later in the day, and we've just received orders to discontinue the fluids for the patient, and so all we gotta do is go in there, of course, identify the patient again with 2 identifiers. Just pretend like that mess isn't there. Okay, so we're gonna go in, we're gonna turn off our flow on our pump, and just gonna loosen up this tape. Explain to the patient that the fluids are being stopped, but the catheter is gonna remain in place just in case we need to access it again. So just be ready with this. Get that bubble out of there. Okay, and then we're gonna make sure and flush this twice a day. So since we're converting it over to a saline lock now, we're gonna flush it now. Okay, again, just assessing the site, making sure that there's no pain, no redness, no swelling, and the patient isn't complaining that they feel anything cold or anything dripping. So that's that. And then after you flush it, you want to put it in the lock position. And then just attach this way prettier than that to your patient's arm. So, real life, that would be way prettier. Okay, so that is in place. We want to clean up all of our stuff. It's been a couple hours later, and the doctor has ordered that we go ahead and discharge Miss Shirley. So we would again enter the room, verify the patient, verify the orders each time, and just discontinue the IV. And to do that, you would have a piece of tape ready. I would have changed my gloves every time, hand hygiene every time. And Miss Shirley is ready to go home. She's excited. Tape and gloves, it's super, super fun. Okay, so all you gotta do is gently loosen up all of this dressing and tape. And earlier I would have documented the amount of fluid that was infused, the type of fluid that was infused, when it was discontinued, and now we're just going to pull this off, make sure these are all loose. Really get stuck to these mannequins. You just don't want to tug on that hub too much when you're doing this too. Just kind of secure it. One more. Okay. Go ahead and get my gauze. I'm just going to take it right over the site and pull straight back. At that time, you want to assess the tip of the catheter, making sure that it is intact. Hold the dressing here for about 30 seconds, and then you just want to switch out your gauze, and add your tape. And this is a pressure dressing, so that's there. They can keep it there if they want. Okay, at that point, you want to go ahead and document that the catheter tip was intact and that the site assessment and the name of the person discontinuing. And I believe that's everything.